Hello, and thanks for joining us to learn about how to help teens cope with the impact of and restrictions related to COVID-19. This information has been adapted from the Canadian Psychological Association article by Dr. Lisa Votta-Bleeker, Deputy Chief Executive Officer for the Canadian Psychological Association. Adolescents are likely to be strongly affected by public health emergencies, such as the novel coronavirus. Public health directives to reduce transmissions have likely meant cancellations of organized sports teams and recreational activities, missed celebrations like graduation, canceled school trips, reduced or lost employment, loss of opportunities to socially engage with peers, and loss of in-class academic learning. These impacts, combined with direct exposure to the virus through social and TV media coverage, may challenge their coping skills in very significant ways. The stressors of COVID-19 come during a period of great physical, social, and emotional change for adolescents. At a time when they are forming identities, beliefs, and values, they may be more likely than adults to act impulsively, push boundaries, and assert their invincibility. These latter behaviors may make them particularly vulnerable to contracting an infectious disease like COVID-19. In general, most teens are strong, sensible, and have good social support systems that will help them cope and respond well to distressing events. Nevertheless, a major stressful event or public health emergency can have many effects on teens. Some common reactions include worries, fears, and anxieties about their safety and the safety of family and friends, fear of other major emergencies, negative ideas about and mistrust of others, particularly those of different backgrounds, increase in disruptive behaviors, for example, arguing, defiance, and angry outbursts, increased crying, sadness, or depressed feelings, more difficulty concentrating or paying attention, variations in energy levels, either less active and tired or more active, impatient, and agitated, problems sleeping, either sleeping too much or not enough, problems eating, either eating too much or not enough. Teens need the adults in their lives to pay attention to their feelings and reactions. Remember that teens can cope with stressful situations and you can help them. They will express their feelings in different ways, both directly and indirectly. Teens need your assurance that they are safe and that you will be there for them if they feel upset. Teens will be impacted by the ways in which they see parents and other adults handle the situation, so it is important to be mindful of your own reactions and engage in good self-care. This experience of lockdown, forced closures, and physical distancing is new for most people in today's world. Your teens are likely in the house more during this pandemic than they have been for a long time and will be again after the pandemic has settled. Cherish this time with each other. Many of the reactions that teens may show during this time, including a certain amount of moodiness and arguing, can be normal features of adolescence. Don't overreact. You should, however, pay attention to behaviors that are new and to any that are really disturbing to you, and show understanding and support. If the behaviors are dangerous or seriously disruptive, or if they don't improve after a few weeks, parents, family members, or teachers should help the teen get help. On the other hand, teenagers may pretend not to be affected or concerned, in an effort to convince themselves that they are invincible or to appear above it all and cool. In reality, they may be scared, confused, worried, and in need of your help. Here are some suggestions on how to help your teenagers cope. Grief includes shock, denial, anger, numbness, sadness, and confusion. It is a normal response to loss of all kinds, including those associated with the real or feared losses during public health emergencies. Nothing like COVID-19 has ever happened before in most of our lifetimes. Because of the changes to our daily lives as a result of COVID-19, teens are missing once-in-a-lifetime events such as school trips, graduations, proms, and there's no way to stop or rewind the clock so that they can have those moments back. While loss of life may trump the loss of a prom, losing out on milestone events is significant and painful for everyone. Let them talk to you about what they are missing. Don't dismiss their concerns and distress. Hear them and understand that these are big moments in their lives, and let them grieve the loss of these experiences. Explain that it can take time to get over a loss and encourage them to be patient with themselves and with others. Offer reassurance based on the real steps that are being taken to address the situation, and explain the importance of following public health directives such as physical distancing. Admit that there are things you just don't know, including how long the current situation will last. However, don't hesitate to tell them that many people are working to ensure everyone's safety, and that by following public health directives, we decrease the chance that anything will happen to them or you. Listen to what they have to say about the events and how they perceive them. As best you can, provide them with factual information and help them distinguish opinion from fact. When dealing with difficult circumstances, Watching or listening to something humorous can be helpful. However, some teens may crack jokes about tragedies in an unconscious effort to distance themselves from their fears. Discourage disrespectful jokes while not cutting off lines of communication. Teens, and people in general, may feel angry about what they have lost. Anger is often based on feelings of threat, fear, helplessness, and vulnerability. Turn the conversation to the underlying feelings. Tell them how you feel and options to best deal with those feelings. Be patient with teens and with yourself. Find simple, daily ways to show teens that you love them. Hugs, words of praise, or fun times together. If your teen has friends who have been directly affected by COVID-19, help them find ways of comforting them. They may avoid talking to them out of fear of causing more pain. They may need help to know how to offer comfort and support, especially in these times of physical distancing. Both you and your teenager may want to limit exposure to news coverage of the virus. Teens should not be shielded from the facts about the virus, but watching too much news coverage can put them, and anyone for that matter, in an emotionally overloaded, anxious state. Watch together and talk about what you are seeing, hearing, and feeling. Maintain family routines, particularly around sleeping and eating. Schedules help. Waking up at a set time, schoolwork, leisure time, and outside time when possible. For most of us, times of stress may not be a good time to make important decisions. If teens are quite upset by COVID-19 events, encourage them to take the time they need to think through any big decisions. Talk to teens about what you think and feel about the circumstances related to the virus so they can understand better. They will gain confidence to deal with their own feelings if you show them that you have strong feelings and that you can cope with them in healthy ways. Stressful events and an ongoing climate of uncertainty and worry can have a greater impact on teens who are vulnerable. This may include teens who have experienced serious bullying, difficult family separations, death in the family violence, sexual assault, a traumatic refugee experience, clinical depression, an anxiety disorder, or other mental illness, a history of drug or alcohol abuse, self-injury, or suicide attempts. Some vulnerable teens may experience a return or worsening of mental health problems or unhealthy behaviors, up to and including suicide attempts. Disasters and emergencies are often times when people and communities would normally come together in friendship and social support. COVID-19, however, is different because we cannot physically come together. While we must keep physically distant from each other to reduce the spread of the virus, we don't have to keep our social distance. We just have to engage with others in a different manner, one which teens are usually more familiar with than their parents. One of the ways to stay connected socially while physically distancing is by staying connected online. In fact, physical distancing requirements may have little impact on the current generation of teens who are used to socializing through their cell phones, tablets, and apps like House Party and Snapchat. Online contact can help teens stay connected to their peers, especially if teens can video chat with their friends or co-play mobile games. Online contact can also allow teens to stay connected with family members and loved ones who are far away or may be challenged by the physical distancing requirements. In this case, teens can be a helpful source of connectedness and support for their loved ones, particularly those who may be elderly or vulnerable. During physical distancing, school websites and libraries can be used to help students complete online-based schoolwork. Online resources may also be used for virtual extracurricular classes, science projects, and social connections like Lego challenges. Teens can benefit from participating in activities that can help them feel better while still maintaining physical distancing. Encourage activities like reading, listening to music, walking a dog, riding bikes, things that help them relax. Some teens benefit from writing their thoughts and feelings in a diary or drawing or painting about their feelings. Vigorous physical activities and sports help reduce stress and make people feel more alert, happy, and energetic. While many teens have lost participation in organized sports, they may still be able to practice or play their favorite sport at home, or take up a new physical activity, such as biking or running. Families can also embrace this time by engaging in activities together, such as tackling household projects previously put on hold, doing chores, painting or redecorating a teen's room, trying out new recipes, exercising together, playing board games and doing puzzles, watching movies, or going for family walks. Some teens may be more at risk for persistent or strongly negative response or even suicidal behaviors. They may benefit from talking with a health professional, such as a psychologist, social worker, physician, nurse, or psychiatrist who can help them understand and deal with how they are feeling. Be watchful and prepared to seek professional help if your teen shows some of the following responses, and keep communication open by checking in to see how they are doing. Behavior problems or learning problems. Angry outbursts. Withdrawal from family and technology-based connectedness to their friends. Frequent nightmares or other sleep disturbances. Physical problems such as nausea, headaches, weight gain or loss. Feeling very anxious or afraid, or ongoing sadness or depression. Feelings of hopelessness about life or the future. Increased risk-taking or problems with the law. Abuse of alcohol, street drugs, medicines, or solvents. Suicidal thinking or behaviour. To obtain important and up-to-date information about COVID-19, visit the Public Health Agency of Canada website or your local health authority. Provincial, territorial, and some municipal associations of psychology often maintain referral services. Teens can also contact the Kids Help Phone. Links to these resources will be in the description below. Thank you for joining us to learn about how to help teens cope with the impact of COVID-19. We hope you found this information helpful and that it will help you have conversations with your teen about their wellness.